What do we do with lower lids? I think that the answer to the questions really depends on what's the problem. What is that thing that's troubling you? And there are lots of different approaches to the lower lid depending on the anatomy and depending on the problem. But it's really important to examine the lower lid to make sure that there's no bizarre pathology going on, to make sure that the lower lid is tight against the globe, because it serves a real purpose. If it's loose, the eye can become dry. There can be additional problems. So the question is, do you need to do a tightening procedure, either of the tarsal plate, which is that cartilaginous portion that provides structure to that area, or do you not? Do you simply need to tighten the muscle? Do you need to get rid of some of the fat? Do you need to get rid of some of the skin? So really, it's a question of breaking down the anatomy into its components, and there are a number of different steps. Each step you have to ask the question, do I need to do this or do I not need to do this? What's good news is that sometimes the pathology or the problem that the person sees is really an issue of having a bit of a hollow underneath the eyelid, between that and the cheek. And sometimes, though not always, the solution is simply to use a filler to add a little bit of volume to that area to diminish that transition and soften it. Bottom line, the only way to really make an assessment as to what's the right thing for you is to come in, let us take a look, let's do an appropriate analysis of what's going on, what are the aesthetic considerations that we're looking at, what are the functional considerations, and then we can come up with a good solution.